everyone. So I am deliberately doing this live show so that I know what are your concerns so that you can put that in the live chat. And the good news is I am going to start with the basics of the Exodontia, which is basically the bread and butter of the dentistry. So Exodontia is very close to my heart. My name is Dr. Alka Gupta and I am a maxillofacial surgeon. And through these videos, through this series of videos, there will be live videos, there will be pre-recorded videos also. So I'll be taking you from the journey of the basic exodontia and then finally the advanced exodontia. My aim is to give as much knowledge to you as possible. I'm practicing exodontia for say good 20 years now. So I have encountered possibly every type of complications in my practice, in my oral surgery practice. So let's learn from my experiences and let's learn from your experiences how we are going to go about it. So in this today's live stream, I am going to explain what I am going to teach in the coming videos or coming live streams. So, if you haven't subscribed to my channel yet, I would suggest that you subscribe to my channel so that you get regular updates about my lives. And I'll be posting a lot of videos on exodontia. I will be posting a lot of videos on suturing methods and suturing materials also. So basically, a small mini courses I will keep on giving you. Apart from the oral surgery, I'll be giving you a lot of things about cosmetic dentistry. I do practice a lot of rubber dam dentistry also. So we'll slowly go into from the basic dentistry to the advanced dentistry in a slow mode. And I'm practicing dentist for the last 15 years now. So I do a lot of exodontia, respiratory work, and the oral surgery practice. So let's start with the exodontia now. So I have kept this name as the clinical guide to the exodontia because this is basically not a course, basically a guide. You will decide your own rules, how you are going to go about the exodontia. So let's start with it. So first of all, I'll describe the contents step by step that what I am going to give you during these sessions. Maybe I will cover these topics in say 50 videos, 60 videos, 70 videos. I really don't know. I will be sharing a lot of my cases, a lot of my experiences, and I would request you that if you have any doubts or any queries, please put that in the comments so that I can make more videos and give it to you. Knowledge is for everyone. If you are sitting in any part of the world or maybe any part of the India, you cannot come to me for learning. It's okay if I can reach out to you through my videos. So guys, do support me. If you like these videos, do share it with your friends and help me reach out to so many people out there. This is my aim that I want to reach out to each and every dentist who is sitting in the villages also and make them to practice very good dentistry, excellent dentistry. So let's go about this. So let's check out the contents of the topic here. So we will be doing the introduction to the exodontia, and so we will be doing the introduction of the exodontia, which will include the chair positions. See, whenever we are doing extractions, it is very important that we keep the chair at a particular position so that your arms and body is not tired. And also, during the extraction, there are a lot of movements are happening. So if you're not doing those movements properly, there is a possibility that you might fracture that tooth. So we do not want that. So we'll be discussing all the chair principles, chair positions, and we'll be discussing in detail about the principles of the exodontia. Nobody talks about the principles of the exodontia as such. There are certain principles that we need to absolutely follow. So we are science people. We are not dealing with anything illogical here. Everything is logical. Whatever instruments are we using, they have a big logic behind it. There are a number of instruments available in the market. People are very confused which instruments to buy and which not. I will give you the guide which instrument to buy and how to decide which instrument to be used where. So this is my absolute aim. So then we'll be discussing about dental forceps in detail. Of course, that is the basic rule for the extraction part. you should be knowing about dental forceps. I have made a lot of Instagram videos on dental forceps, how to use it. You can watch out those short videos on YouTube Shorts also, and on my Instagram profile, which is Alka Gupta Doctor. You can search it and you will find a lot of videos on dental forceps. Then we will be talking about dental elevators, which is kind of my favorite topic because when I started practicing my oral surgery, when I started practicing my exodontia, when I was doing my graduation, and later on the post graduation, this is one instrument which really helped me a lot. This gave me the enough confidence to put my forceps over to the tooth and then finally extract the tooth. So you have to be very thorough with the principles of dental elevators, which will include the introduction part. What are they? How do they look like? What are the different type of elevators that we use in the oral surgery? And then we have different types of the elevators. And then of course the principles of the elevators. Because the principles here, if you're not following principles of anything in dental or the medical line, the failures will happen or disasters will happen. So we do not want that. So principles of exodontia or elevators is extremely important. We are going to discuss that in detail. Then, of course, we are these days we are practicing the atraumatic dentistry. We are not into traumatic one because we need to preserve the bone. We do not do a lot of bone cutting these days. We do a lot of atraumatic extraction because I want to save my bone. Because I want to save I want to save my bone for my implant procedure, for my denture, and I don't want to do a lot of bone cuttings. So I use a lot of dental luxators and pegatomes, and they give me a very good control over my forces. They do automatic extractions. So next comes the in the recorded or the live stream videos. I will be discussing about the maxillary teeth in detail. So we have two jaws, maxilla and the mandible, and of course we have different teeth in the maxilla and the mandible. We have central incisors, lateral incisors, canines, molars, and second molars, and the third molars. So we will be discussing about in detail the maxillary, central incisors, maxillary, premolars, canines, and then finally the molars, along with their anatomy, along with their forceps, along with the luxator techniques and everything. We are going to study everything in detail along with my practical experiences. So, this is everything about maxillary teeth. In these videos, I will make sure that after watching these videos, if you go to your clinic, you are very confident about extracting the maxillary teeth. So, if we move forward, extraction of the mandibular teeth. Extraction of the mandibular teeth, again it comes like mandibular incisors we have premolars, we have molars, we have mandible is a movable bone, so extraction of the mandibular teeth involves a lot of caring of the bone also, joints also, a lot of muscle domestications are also involved. So there are certain movements that are absolutely not indicated, and there are certain movements we do to extract the tooth. So, what are the possible complications that would happen because of the long extraction of mandibular teeth? We are going to discuss that in detail. And this is my favorite part. We are also going to discuss it because most of the times patients do not come for a straightforward extraction. Why would they come for a straightforward extraction? Obviously, they are having a mutilated tooth, they are having a very badly damaged tooth, or probably a case of a failed root canal. Okay, so in that situation, it is not a simple extraction now. It has turned itself into a complicated extraction. So, how to go about it? People get scared after looking at these teeth. Believe me, these teeth are very easy to extract. You don't have to be scared about it. Right. So we'll be discussing in detail about the complicated exodontia or the surgical extravagance, how we are going to practice it, how we are going to use different types of luxator, elevators, and everything. How we are go about it. Okay, we will discuss the introduction part, open versus closed extractions, various lab designs, because don't think that this is the area of oral surgeon. If patient is coming to do with a badly mutilated tooth, then patient trusts you for the extraction of your tooth, his tooth. So in that situation, instead of approaching the tooth in the right way, you will ask the patient, hold it, I will call the oral surgeon, then eventually either you will lose the patient, or even if you try to attempt it, you will be doing it with loose confidence. So there is a possibility that you mess up the whole system. So if you know the right technique, even if you are a general dentist, that doesn't matter. So if you know about the good flap designs, believe me, you will extract any kind of tooth in just minutes. And this is my personal experience. If you do good extractions, listen to this very carefully. If you do good extractions, people are going to love you, because in dental profession, everything is related to exodontia. I'm sure your parents or your friends, non-medical friends or non-dental friends must have called you and asked you, what are you doing? I am sure you are doing the extraction, okay? तुम तो दांत निकाल रहे होगे ना, दांत निकाल रहे हो. Everybody calls me up. My non-medical friends is there. Alka, what are you doing? दांत निकाल रही होगी. So दांत निकालना is very much associated with being a dentist. So if you do good extractions, if you good experience just to the patient, patients really love you. Okay. So if you want more people in your clinic on a regular basis, and if you want for them to come again and again and again, learn good exodontia. Then we will be learning about open extractions of single rooted tooth. Single rooted tooth is there, canine fracture is there, segment incisor fracture is there, lower premolar fracture is there. Then what to do? How to extract a single rooted tooth? How to extract a multi-rooted tooth? Multi-rooted tooth is lower molar, upper molar, and how to go about it. Should I put the forceps? Should I do the elevators? Which technique should I follow? All these questions I'm going to answer in detail. So then we will be focusing on the multiple extractions in the cases where people have to undergo multiple implants or a denture case. In those cases, or any kind of issue like patient is undergoing radiotherapy or any other issue, then multiple extractions are usually needed. Then we will discuss about how to go about multiple extraction, which tooth is to be extracted first and which tooth is to be extracted later on, and why is that. So we will be discussing that in detail. So next comes, see, every dentist or every doctor should learn to handle complications. It is not difficult to do a procedure, but it is very difficult to handle the complications. But if you know beforehand that these complications can happen, suppose if I'm extracting a lower molar, I know there is a possibility of an inferior nerve damage. Okay, then I'm cautious about it. If you don't know about the complications, then how would you be cautious about it? Or bleeding complications, how would you take care of a patient so that there should not be any bleeding complications with. So we are going to discuss that. We are going to discuss about various complications, in which I have covered two main complications of exodontia, which is the dry socket and the hemorrhage. Dry socket is an extremely common complication of traumatic extractions. So we are going to understand what exactly is dry socket and what exactly is hemorrhage and how to manage it clinically when patient present to you with such problem. How to handle it in practice management types, and how to handle it actually in patient's mouth. Both ways, that you do not need to spoil your name also. The traumatic extraction has been done. Now how to save yourself, how to save patients' trust on you, that we are also going to discuss. So we are going to discuss the complications of the exodontia. Then this is the starting part. So the purpose of this live video is to give you the overview of the whole Exodontia course that I am going to give it to you and be with you in the form of pre-recorded videos or in the form of a live video, because I'm more of a face-to-face person, I'm more of a live video person. This whole thing is not at all scripted. Everything will be coming from my own heart, from my own experiences. Every complication that I'll be explaining, believe me, that has happened with me, and I've seen that. I've been failed many times, even after finishing my oral surgery MBS 10 years, 15 years. There were cases where I failed. I failed to manage very deep infections at times, not every time. I would say once or twice in my career till date, but I'm not ashamed of it. That one or two incidences, they gave me a lot of courage to move forward. I studied a lot and then finally found out my mistake where I was wrong. So I learned a lot from them. So I did a lot of mistakes. So I want you to learn from my mistake, because there is a saying that says it is very cheap to learn from others' personal mistakes, and it is very costly to learn from your own mistakes. So I want you to make mistakes, but before that, you learn from my mistakes. Even after that, you will do a lot of mistakes, but you can ask me. You can put your problems in the comments. You can discuss your cases with me. In the description, there is a WhatsApp link. You can drop your WhatsApp message to me. We will create a learning community on the WhatsApp also, where people will be putting a lot of questions, and once in a while I'll keep on taking these sessions to solve their queries. So it's important that we practice good dentistry and we impart knowledge. But I am giving you this knowledge and I want something back from you. Okay, so what I want from you, that whatever you are learning from this podium, you will be shifting that to another person who needs it. There is a possibility that some people do not have that kind of a time or privilege to watch these videos or understand these videos. Then it is your duty to make them understand. It is your duty to discuss these concepts. So anybody who takes benefit from these videos, take up one or two dentists in their local areas. So make a group and tell them that whenever they have a problem, they will ask you. And if you do not understand their problem, you send those queries to me, or send those comments to me, or send those problems to me. And there is a possibility, if I might not know everything, I'm still in the learning phase. I will always learn throughout my life. But the thing is, even if I do not have the answer, I guarantee you that I will find that, no matter from there. So, help learn others also if you truly want to learn, right? So, this is everything about Exodontia practice that we are going to start in the coming days. I am going to announce my next live, where I will be discussing this first component, which is the introduction to the exodontia, chair positions, and if time permits, the principles of the exodontia. You can mention in the comments which time is most suitable to you. I'm planning somewhere around 9 to 10 p.m. any day, 2 days of my choice in the weekdays, not the weekend. And secondly, the session would be around 30 to 45 minutes. I think that is okay. So, I hope that time is suitable for you, everyone. So, let's start with it. Let's start our journey together. And wish me luck. I wish you luck. Whatever is my experience, my ultimate aim is to give you something from my own experiences. So, this is Dr. Alka Gupta signing off right now. So, see you on another live with the topic of exodontia, which is chair positions and principles of exodontia. Subscribe to my channel, switch on the notification bell so that whenever my live notification is there, you get instant notification. Do not miss on the live. I love you guys.